Good morning, everybody. This is Matt Melton, Planning Section Chief at the Anchorage GOC. This is the COVID-19 response external update for April 8th.
Yes, good morning. This is Adrian Doobie, Documentation Unit Leader, reporting for Luke Orat on day 400. In Anchorage, our cases are shown at 28,426. That's an increase of 333. Deaths remain at 164. Hospitalizations are currently at 755. That's an increase of 6. You'll see that we have filled and satisfied 1,729 213 RRs. That's an increase of 2, and we are currently working and have opened 13. Next slide, please. Transport. We are at 30 in the last 24 hours, 2 after hours. For sheltering at congregate sites, we show 395 clients, a decrease of 5. At non-congregate sites, 351 clients, an increase of 7, with a total of all shelters being 746 clients. That's an increase of 2, and providing 2,238 meals a day. Testing for 4 of 7 was 884 samples collected. That's a rate of 80 per hour. And in vaccines for 4 of 7, a total of all pods, 48,522, an increase of 656 doses to date. Ending report.
Thank you, Adrian. Weather.
Good morning. My name is Cynthia with the National Weather Service in Anchorage. We will see continued snowfall ending this morning into the early afternoon. And then things are going to get really interesting tonight. We're expecting strong northwesterly winds with gusts up to 50 miles per hour. That is going to usher in cold air tonight and tomorrow night, where we will be approaching 0. With that increase of winds, that means that wind chills could potentially reach negative 25, which means that frostbite on exposed skin would happen very quickly. So be careful out there the next couple of days. End of report.
Thank you very much, Weather. Operations.
Good morning, everybody. This is Rick Meredith, the Operations Section Chief. For our mass care branch, we have 18 predicted discharges through Sunday and 2 today. The Warmington had 65 people over the last 24 hours. We've seen a decrease in our mass congregate shelter, which is traditional for this time of the month and this time of the year. So it's opened up some opportunities for providing more shelter to some of our clients. In our public health branch, the testing has increased 2.61% over basically the last Tuesday sample collections. That's a good sign. We keep encouraging everyone to go out and keep testing. That helps drive our positivity rate down, and it's gone down a little bit. It's now down to 3.22. For our pop-up testing, we'll have it going on at 800 K Street and at UAA today, and then on the 10th at Mountain View Elementary. And with our medical countermeasures, the Northway Mall has a tentative start date of the 15th of the month. Fairweather at the Alaska Airlines Center has walk-ins available. There's a new J&J allocation. We're looking to discuss how to get it out to visit in Fairweather to maximize uptake in the community. And we're partnering with Conquer COVID Coalition to bring clinics to businesses and workplaces. Our task force is also working with Tote Maritime. And I'd just like to mention that we have over 2,000 available appointments right now at all of our locations throughout the municipality. So encourage people to go out and get vaccinated and provide a protective layer for our community. Pending your questions, that concludes my brief.
Thank you, Rick. Logistics.
Good morning, everyone. This is Scott Carpenter reporting out for logistics. First and foremost, want to do a public shout out to Mike Braniff. We'll lose him today back to Parks and Rec. And a continued shout out to the Parks and Recs folks for sending such great support over to the EOC to support the COVID-19 efforts. Moving down the slide now, medical countermeasures. We continue to support the vaccination sites. Preparations are underway for the Northway Mall. Get that all set up for a future opening to include snow removal. Under mass care, we continue to work through what the summer requirements will be, as well as contract modifications as necessary to ensure everything's running smoothly there. Under the EOC support, we continue to work our transition planning between the EOC and AHD. We have additional staffing requests for EOC personnel that we're working through, and we're doing some translation services for PIO. And as always, we talk about the PPE requirements and test kit request. You can still request those through the attached information at the bottom of the slide. Pending any questions, that concludes logistics.
Thanks, Scott. Finance.
Good morning. This is Carrie Wiedeker, the EOC Finance Section Chief. Currently, the EOC has encumbered $20,493,158. Our actual spent to date is $45,076,855 for a total of $65,570,014. Please, if you have invoices for the EOC, continue sending them to eocinvoices@anchorageak.gov. The Office of Emergency Management does continue to seek cost recovery by way of FEMA public assistance. Contact Erin Zachary. Her email address is on the slide if you have questions. End of report.
Thank you, Carrie. Safety.
Good morning. This is Annalisa Roberts reporting out for safety. So as I mentioned on Monday, April is the start of Driver Awareness Month for safe driving. Hands-free is not risk-free. So every day, seven people are killed and more than 700 are injured in distracted driving crashes. There's a lot of good information on this. But how does this relate to COVID-19? So distracted driving has been a growing public safety threat, but now with COVID-19, it's found that the use of cell phones has been growing exponentially since people can't meet with their loved ones. They've been on the phone a lot more. So with that, with less vehicles on the road, some drivers think they can operate their automobiles with less attention. In some areas of the country, it's actually spiked distracted driving with people eating, fiddling with the radio, texting, and talking on the phone. People have also been speeding because there's been less congestion on the road. And others are so distracted by the stresses of COVID-19 that they are having a hard time focusing on driving. So all of these are leading to crashes that are seriously injuring and killing people. So if you don't have to be on the road, don't be on the road. And when driving, be vigilant, and keep a constant lookout for the reckless acts of others and yourself. So try to stay off your phone. Wait until you get to where you're going to call loved ones, or definitely don't text and drive. It's illegal in Alaska and most other states. So just keep that in mind. End report.
Thanks, Annalisa. Public information.
Hey, good morning, everybody. This is Kale Casey reporting out for the information officers. Our social media campaign includes boosting the Diamond Center through tomorrow. We're also messaging the pop-up sites at 800K Street, and we added some messaging this morning for the earthquake with a preparedness message. And we will also add additional messaging in both high and low tech for our PEH population so they can be alerted about the extreme cold weather coming in. We're coordinating with the Anchorage Health Department PIOs on the proposed May 1st through 8th vaccine week to increase awareness of vaccination opportunities, and we'll fill in more on that. We're strategizing with Northwest Strategies and the AHD PIOs on a full TV and ad buy for that proposed week and the lead up to it. PIO RUP is obtaining the state of Alaska materials for posting and distribution as part of our low tech strategy. PIO Rona will be at the Beans today for Senator Murkowski's approximate arrival time of 10:30 for the Sullivan Arena Tour. And our daily outreach continues to go out to key influencers and community leaders, including flyers, testing locations, vaccination opportunities. End report. Thanks.
Thank you, Kale. Liaison.
Good morning. This is Celeste Prescott reporting out for Liaison for the Anchorage Emergency Operations Center. I'd like to thank all of our partners who were able to join us. And do we have Kirsten on for the Alaska Native Medical Center?
Good morning. This is Kirsten. This morning we have 4 positives. One of those is in the ICU, none on ventilators, and we do have 5 PUIs.
Thank you very much. And Sean is on for Alaska Regional Hospital.
Good morning. Alaska Regional Hospital currently has 5 COVID positive patients. 3 are in the ICU. 2 of these folks are on vents, and we have 2 PUIs.
Thank you very much, Sean. And do we have Michael on for Providence Alaska Medical Center?
Good morning. We have 17 positives this morning. That's an increase from 11 yesterday. 6 of them are in the intensive care unit and 3 are in ventilation.
And I believe Kara is on for Mat-Su Regional.
Good morning. It's Kara Cahill from Mat-Su Regional Medical Center. We currently have 12 positive patients with 6 in the ICU. We actually are now up to 4 on ventilators, 0 PUIs, and we have 2 COVID recovered inpatients. Thank you.
Thank you, Kara. And that's all for liaison. Thank you.
Thanks, Celeste.
Good afternoon. Today is a reminder that we don't get to control the operating environment in which we have to overcome COVID in several ways. I think the weather points to an elevated risk for all of us in the coming 24 hours between the wind chill, the winds, the new snow that's come down, and some acute risk for the unsheltered that we need to reach out to for the mass care side. Also, the little shaker from up by Cantwell is a reminder that we don't get to sequence when disasters strike. So at any given time, we have to do what we need to as individuals and as organizations to deal with a incident within an incident or a simultaneous disaster, however you want to call a earthquake hitting in the midst of our pandemic response. Just need to keep that focus, keep that preparedness, and keep that agility. End of report.
Thank you, Bob. Our next briefing will be Monday the 12th at 10 a.m. Thanks, everybody. Have a great day.